Hello, everybody, and welcome back to CCA's Medical Minute. We're going to do a little different twist today, maybe a little bit less medical. You were just talking about all this stuff. I can't believe all the stuff that you know. Fellow executive director of a charity, but you know a whole heck of a lot about cancer.
Are we going to have another bleep? Jeez, beep.
Starting to get loose. I don't have my workplace discipline anymore. But anyway, I'm really proud today to have one of our dear friends, Jill Settlemyre. And so she's the executive director of Cancer Family Care here in Cincinnati. And so we'll kind of cut right over. I wanted to have, just as we kind of serve the greater Cincinnati area, and then sometimes we loosely define what that area is depending on the need and someone's ability to get to us or not. Let us know about kind of what area does Cincinnati, does Cancer Family Care serve? Kind of what a patient population looks like for you guys, how many patients you serve a year, and then we'll get into a little bit more about some of the detailed programs you have, because you have some really great programs.
Great, sure. Well, thanks for having me. Poor Steve is stuck with Jill Squared today, but we'll make it work for you, Steve. But Cancer Family Care, so we are local. We are a local Greater Cincinnati, Northern Kentucky based. We do have satellite offices across the tri-state area, including in Northern Kentucky, hopefully soon to be in Indiana. Be able to serve Indiana residents as well in the next year or two. We serve for our counseling programs about 2,000 individuals a year. Total, when we look at family members, about between 4,000 and 5,000 annually. Wow. We serve. So big, big operation, very small. Okay. So we have we have a very small staff. All local, so it's pretty amazing. What we hear a lot is that, well, I really want to find a Cancer Family Care in XYZ city or state. They don't exist. It's just us.
So that's funny, because we've talked in the past about trying to take our model and put it elsewhere. Probably it might be a little bit more labor intensive because you have to get an oncology team and things like that. So we've struggled with that, but we have had interest from a couple other cities as well, some people wanting to do that. But.
Well, and that was one of the things that was really funny, because with our Naples location, I was actually down there meeting with some of the community resources and various programs that they had. And I said, do y'all have a Cancer Family Care down here? And they looked at me like I had two heads. And so then I started to explain some of the services that you guys offer and what you do for cancer patients. And they were like, no, we don't have anything like that.
Yeah. We want one. That's what we always hear. We want one.
Yes.
Okay. Is Diana? So my wife Diana ran into you at St. Elizabeth over in Northern Kentucky. Is that actually a location for you guys?
It is.
Now?
We have two.
Okay.
We actually have two offices right in the cancer center.
Oh, nice. Okay.
So we have two therapists who are there 5 days a week.
And I remember it well because you gave her an iced cookie.
I did.
And that was one of the highlights of my day.
I did.
Particular day. So.
It was a survivorship celebration.
All
and
right. Feel free to send those whenever you like. They were delicious. No, that's fantastic. And so one of the things, and it's just timely that we're able to have you in today, because because I want to talk about some of the things that matter to cancer patients as they're going through their journey. And it's timely for me right now as I sit here on my sock feet, because I'm got so much inflammation and things from what I'm currently dealing with my own cancer case. I can't even get shoes on. So that's why I'm sitting here like this. But some of these services, and I know Jill, I know we refer. In fact, well, let's start there. What do we do with our patients in terms of letting them know about Cancer Family Care?
So every patient that comes in to Cincinnati Cancer Advisors for a consult, part of the assessment that we're doing is just their psychosocial assessment. How are they doing on this walk? And you'll find that patients who are early in their diagnosis, who this is an early stage disease, it's pretty cut and dry, they're usually in a good headspace. But our patients who have literally it's turned into a chronic illness, it's constantly one thing after another, and just when they feel like they've stood up and dusted themselves off, somebody's yanked the rug out again. And as we're seeing those patients, you can see what we refer to as the battle fatigue. And you can see it. It is physically visible. And so with every patient that comes in, even if they are an early stage, because sometimes you just need a little extra support getting through that from somebody that you don't have to explain the details of where you've been to get to this point. And so every patient that comes in, we talk to them about how they're doing emotionally and with their journey. And then they all get an information card on Cancer Family Care. There have been some patients who I don't just put the card in the envelope and tell them about it. I'm like, nope. You need this, and we're not leaving here today until I get you connected.
Yes.
Because there are some patients who are just, if you cannot make it through a consult with us without crying, and I'm not saying that there is anything wrong with tears, because there are not, but if the emotion is that overwhelming, then we are to a point where you need the additional support.
It's also on the flip side of that too. And I'm glad you said that about, if you can't get through a consultation with crying. We also look at individuals who go through everything and think they can't cry and think that they shouldn't cry and that they're going to be seen as weak if they cry. And so those folks need Cancer Family Care Services just as much. So it really is that twofold. So I'm glad you said that. So that gave me the perfect opportunity to say, you are struggling with cancer. Cancer Family Care is the place to call.
Well, and the other things too, because we were just talking offline a little bit ago, and you were. And it's an interesting point, because I wonder about women versus men, and what I mean by that is
that's kind of what I was leaning toward. But you said it, Steve.
Like you were throwing it, healing touch and different things, and I'm an old school guy. I mean, I'm 61 years old, and so I listened to you. I was intrigued by it, but it seems like I think about my peers and the age of guys that I grew up with, and them saying I'm going out for a Reiki or a healing touch massage or whatever it might be. I think that acceptance is lower, right?
It is. It absolutely is. I do think we're coming a long way in terms of talking about mental health and talk about integrative care and caring for the whole patient. We've come a long way. I've been with Cancer Family Care almost 12 years now, and just in that 12-year span, I've seen a huge shift that it's okay to talk about it now. It's okay to say, I'm struggling. I really am struggling. And I also think, and especially for men, that as you're thinking through those things, and you're like, how would that be viewed as? If you walked out of a healing touch session and you said, you know what, I feel relaxed. And that little nagging kind of ache I had and kind of, right behind my ear is gone now. Your buddies are going to go, whoa, how'd you do that? Yeah. Tell me more about it. And so I think talking about it and really explaining to people why you're doing what you're doing. Yeah. You just want to feel better. Yeah. So whether it's, a therapy session, or whether it's, an oncology massage or healing touch session, whether it's coming in for head coverings or wigs, that's another one of our programs is a free wig program, which is really what I love about that wig program. And my office happens to be right next to the wig room, so I get to hear a lot of the, the conversations that happen. But our volunteers that handle our wig program are so amazing that they're in tune to what those patients need, and they're able to talk to them about the other services. And so when somebody's coming in to get a wig, it's kind of that I hate to use the word sales, but it's a soft sell for counseling programs because they already see it.
I cannot tell you how many patients we have referred for supportive counseling and management, and the patients come back and they're like, I met with the therapist and they were great, but then I also got signed up for this and this, and I was like, that's exactly what I need you to get in and at least make the step, and then hear all of the ways that they can support you and help this be a little less overwhelming and daunting.
Yeah. Right. And you guys are, I think funded similarly to us, right? You do events, but then you have kind of your large, very generous donors, and thank goodness for those. But it's kind of the same mixture, kind of.
It is.
Okay.
92% of our funding is private funding. It's individuals, it's grants, it's fundraising events. 8% of our revenue is from insurance reimbursements and client fees. If somebody can't pay, they don't.
Yeah. Okay.
So we just don't care about that.
Well, and then because I do want to spend a little bit of time about the various programs, and you've touched on Wigs, we've Healing Touch, but we can cover a little bit more of those because you guys have a nice range of services. But one thing I think that's really cool that you guys do is the unsung hero. program too, because that recognizes oncology professionals as well. And
as well as caregivers.
Yeah, I agree.
Yes,
I agree.
yes.
And I think I think to give out some recognition and kind of encourage those people and pump them up a little bit, make them keep doing what they do. I think it's a really nice program. I happen to be a prior honoree. I'll just say
Yes,
it.
you are.
Yes.
Deservedly so. In every area. I mean,
You're too
honestly,
kind.
you hit all three of our categories.
All
So you know.
You're too kind. I set my own trap right there. But no, it's just a great thing. So, let's talk about cooling caps that you intrigued me before. So this is a program that can help keep you from losing your hair during chemotherapy. And how do those work?
Now, we don't do the cooling caps.
Okay.
They're done in the hospital
Gotcha.
systems. But we have had a lot of women who have tried the cooling cap and it wasn't for them.
Okay.
So then they came in for wigs. But we definitely sometimes we'll have folks donate their supplies when they no
Interesting.
longer need
Okay.
them, and we will get them over to the hospital systems.
Gotcha.
So that, if there's a patient who would like to try the cooling cap but doesn't have the money to buy the supplies,
Right.
we're
Yeah.
able to kind of help with
That's
that.
cool.
So
And on wigs, when you guys talk about wigs, this is kind of funny because when my wife Diana was diagnosed with triple negative breast cancer, actually, and she, when I met her, she always had this beautiful long hair, and she's always had great hair. It's changed, the styles have changed over the years, but when she got diagnosed with breast cancer, and she knew she was going to lose her hair, and I said, whatever you want, I don't care what it costs, and so. So she went out and got a very expensive human hair wig with my encouragement. She
Hated it. Yep.
hated it, absolutely hated it.
I
Yeah.
have told more patients than I can count on all the fingers and toes in this room.
Yeah,
Do not go out and spend almost $3,000 on
Yeah.
a human hair wig, because it will be just as uncomfortable
Yeah.
as a $25 wig that you buy off of Amazon.
which is what she ended up doing.
or a free
Yeah.
wig that you get from Cancer Family.
Right,
Care.
exactly.
Correct.
Yeah.
And I tell all of our females, you want a wig because on those times where you have a wedding to go to or some special event and you just want to have hair. But for every day, find the cute little wraps for your head and all of the different things that are comfy and aren't uncomfortable.
Yeah.
You need a wig, but because you're not going to wear it very much, do not go
Yeah.
out there and spend a crazy amount of money.
That's what she
Exactly.
ended up getting a whole bunch of cheap ones off of Amazon. So she'd go to work one day as a redhead.
Yes.
She'd go to work one day with
Yes.
short hair and a little beret. I mean, so she started to have fun with it, really, to be honest. But-
My all-time favorite patient, she was a lymphoma patient, and I think she was a physical therapist at Children's.
Okay.
And she came in on St. Patty's Day for her treatment and had a green bob wig. It was, and when I tell you green, I'm like green. But she walked in, I was like, you are the cutest thing I think I have ever seen. Like, it was perfect.
Yeah.
And I do feel like those patients that embrace it
Yeah.
and make the most of it.
Right.
And kind of like that.
Yeah.
I've never been a redhead. Let's see what I look like
Yeah.
as a redhead now.
Well, I don't know if you're like this, Jill, but my hair, I can look in the mirror every day and just think like, ugh, I don't like the way my hair looks today. So when women come in and they say, I want a wig that looks exactly like my hair does now before I lose my hair, I say, do you really?
Yeah.
Do you really? Because every morning, do you look in the mirror and do you love your hair? And or is it a pain?
Yeah.
Oh, that's kind of a pain. Well, think about it this way. With a synthetic wig that you get for free from Cancer Family Care, you take it off the end of the day, you put it on a stand, you get up the next morning, you put it back on, and that's all you have to do. You don't even have to brush it.
Yeah,
It's the same.
that's cool.
So it helps that kind of that mental piece too, to be like, you know what? My new normal, I'm going to have a new normal. And my new normal is going to be, I might be bald for a while, but it's hair, it's going to come back, and it's a big piece of who I am. Many women identify with, their hair as part of their
Yes.
identity. But hey, let's just change that identity a little bit. What's inside of it is still the same. So go be a redhead, go be a blonde. My favorite is an 85-year-old lady that came in, and her adult son came in with her, and I said, well, what color was your hair before you lost your hair? And she said it was brown. It was dark brown. She's 85. Okay, so it wasn't dark brown.
no.
And her son says, Mom, your hair was gray. And she said, no. The first time I had cancer, when I couldn't get a wig because we didn't have any money and there weren't places like this, it was brown. So I want to have brown hair. Then she looks at me and says, honey, is it true? I said, is what true? Do blondes really have more fun? And she left with a blonde wig.
Stop.
And she was just a hoot. I mean, she was just so fun.
That's cute.
And I think that was just for her, just something that it helped her son too, because he was really concerned about his mom. And so I think that's part of with Cancer Family Care too. I joke with our staff about it. Family's our middle name. But it literally is our middle name.
Yeah.
So it's not just about the cancer patient, it's about their family members
Gotcha.
too. And so it's helping relieve that burden of the family members. So, about a third of our counseling patients are loved ones of cancer patients. So
Okay.
it's not just the cancer patient.
That's actually how I have gotten quite a few men in the door. So the patient themselves, because men tend to be a little bit more resistant. We'll use that
Yes.
word.
Yeah.
Yes.
I
I use stubborn, but
I right, strong-willed. But I will let them know that the services are there for their spouses, for their children,
Yes.
and I usually play the kid card. Like, they do a great job at helping your kids to understand, what it's like to have a parent that has a cancer diagnosis, and just to process all of that in a way that a kid can understand. And so then they're like, oh, yeah, that's important. And then they get in the door,
yes.
and then y'all work your magic.
Yes. Yes.
So when I think about ways that you can help a cancer patient physically, so we talked briefly about Reiki and healing touch, massage,
Oncology
Okay.
massage.
Okay.
So the Waddell Family Healing Hands program, amazing program. We contract with oncology licensed massage and healing touch therapists throughout the city. And all that takes, that's the only one of our programs that needs a physician referral.
Okay.
Or someone from the medical team, just because we want to make sure that
Right.
we want to make sure that nothing, there's nothing going on medically that
Right.
massage or healing
Make it
touch would
worse or-
harm.
yeah,
So,
gotcha.
but it's pretty amazing. I have yet to hear anybody complain about the program.
Okay.
Yeah.
Oh, I got 2 free massages.
Right.
Yeah.
Darn those people.
How dare they?
Exactly. But then you talked about counseling as well. And
Counseling
it's-
that's the main thing that we do. That
It is the main thing.
That's our main focus. Our
Okay.
main focus, our number one program is individual, couples, and family counseling.
Okay.
For both the patient and the family members.
Okay.
And as Jill mentioned, we do work with children, ages 5 and up, and do a kind of different modalities with kids, some play therapy, some music therapy, some talk therapy. And it's really amazing for kids who, we're lucky to have Children's Hospital here. They do an amazing job with kids who have cancer. They address those psychosocial needs in-house. It's kids whose siblings have cancer, or parents or grandparents, and are really struggling with what's going to happen, who's going to take care of me, are they going to lose their hair? What are they going to look like when they lose their hair? We have some teenagers who come in and help their moms pick out wigs, and and it's just therapeutic for those kids as well.
I mean, is it? On the counseling side, does it range all the way up to end of life counseling
Absolutely.
and hospice and things like that as well?
Absolutely.
Okay.
Yes.
Gotcha.
Wherever the patient or family member is where we meet them.
Okay.
So it's also survivorship.
Okay.
So there are a lot of folks who ring the bell. I should be happy. I should be,
Yeah.
I should be doing backflips down the hallway. Why am I so scared? Why am I sad? Why am I still so angry? I'm surviving. Why should I, why should I feel like this? That is so natural.
Yeah.
That is such a normal feeling. And so a lot of folks in survivorship also need our services.
Yeah. I don't think I ever told you this. So I just finished up radiation to my spine. It was only about 10 or 11 days ago. And so when I went to leave, because now I'm in this little motorized scooter thing, which is actually pretty cool. But I went to leave, and they all know me now because I've had radiation so many times. And they were like, "Yeah, you're not going to ring the bell." And I'm like, "I'll probably be back here soon, I'm sure. I'll just save it for some other time." But I mean, I laugh, but I mean, I do
true.
I find myself now at a crossroads. In fact, I reached out to you guys recently, just trying to figure out how I could access someone to speak to, and I still need to get up and see you to do that.
Yeah,
But could I do that in Northern Kentucky now? Or?
Yeah, absolutely.
Oh, I could. That would make it a lot
Sure
easier. Okay.
Sure could. We also do telehealth.
Okay.
So we do virtual visits so that,
Gotcha.
for some folks, that's just easier for them. Don't have to get out and
Yeah.
go somewhere. And so
Gotcha.
And the traveling, getting there and getting back
True.
just takes a lot out of,
It does.
of
Yeah.
people. So
It does.
having a telehealth option is great.
Yeah, that's really nice. So how, like say for example, if I wanted to set up something in Northern Kentucky, you just call
Same.
you guys, just call your main number and okay.
Main
All right,
number.
gotcha.
Everything runs through the main number. So we have the 2 offices in Northern Kentucky. We are our main office is on Red Bank in Madisonville. We are on the east side. We have an Eastgate location. We have a Western Hills location. We have a location in Hamilton now. So we are 2 days a week in Hamilton.
Really?
We are 2 days a week in Clifton. And then we are 5 days a week at Westchester Hospital as well. And so it does not matter. We're co-located in most of our facilities are co-located with, with our awesome health systems here. But that doesn't mean if you're, a Christ Hospital patient, you have to go to a Christ Hospital location, or if you're a UC patient,
Right.
you have to be seen at a UC, or, if you're from, out of town, you have to come to Red Bank. That doesn't matter. And that's what, I just have to put a plug in for our area that we are so blessed to have such great oncology care here that whatever the patient needs is what people are going to offer.
Right.
And so it doesn't matter whose patient you are. Our services are there for you.
So I'm gonna ask you a crazy question, but it actually is a little bit. It has some seriousness behind it. So with what you just described, let's just say that Cincinnati Cancer Advisors keeps growing up and getting bigger, and let's just say someday we ended up in a bigger space. Is there literally? Could you guys put a little outpost here?
Absolutely, we could.
That would be kind of cool.
Yeah.
Someday.
Yeah, because our awesome donors are gonna come forward, support that, and say we're
Yeah.
gonna.
Hey, I
we're
hear
gonna-
Paycor's moving out.
That's a good point.
Yeah.
They've got some space.
But that is the beauty for us, is that we really want we want to have our therapists where patients need us
Yeah.
to be. Obviously we're going to have a main office location where
Right.
where the majority of our staff are housed, but we really try to make sure that we have a presence
Yeah.
also where the people who need us are.
Yeah.
I've got this place down in Naples.
I'm not a therapist, but I
can play one on
run
TV.
it.
You'll learn.
I stayed at Holiday Inn Express last night.
Right?
Well, Jill, it's been great having you in. And so we talked about they can call your main number, which is
731-3346.
Okay.
Area code 513.
Okay. And
And
then
is that even for the Northern Kentucky
It
patients?
is.
oh
It
wow.
is.
Okay, gotcha.
Or cancerfamilycare.org, and you can read for yourself.
Okay. All right. That sounds good. Jill, anything else? Nope. So one of the other things too is Cancer Family Care is a member of the same organization that we are, which is the Cincinnati Cancer Consortium. And you mentioned that we're so fortunate to have great oncology care here. We're fortunate to have some really great organizations here too that support
Absolutely.
cancer patients. And
Agree.
Absolutely.
So Chris, we should have more of the consortium folks in. I think try to do that a little bit more often. Get a chance to let everybody know what's available.
Exactly. It is amazing. One thing that I always tell any cancer patient or any oncology professional, if you're not sure who to call for what your patient or what you yourself need, pick one.
Yeah.
Pick one of them and call them. Pick Cancer Family Care, pick Cancer Support Community, pick Cincinnati Cancer Advisors, pick someone and say, this is what I need. And
Because
we're
we
gonna
all know.
get you. We're
We'll
going to get you where you
to
need
go.
to be. We don't do transportation. We're going to get you over to somebody who does. We don't do this. We're going to get you to somebody who does. You need house cleaning or meals. We're going to get you to where there's going to be some things available. And that's what I love about the nonprofit mentality, especially in oncology care in this area.
Agree.
Is that I think everyone that's involved in oncology nonprofit, we're all here because it's personal to us. We've had a loved one or a family member or ourselves, and I think that's why we do what we do, and that's why everybody, regardless of the name on our door, helps everyone.
So we're going to close out, but I can't let you leave. You have to pronounce your maiden name and spell it before we.
Okay,
All right.
so my maiden name, Przygocky, in Polish is Przygocky, and it's Przygocki.
It's an eye chart right there.
Yeah.
All right. Well, Jill, thanks for coming in today. Really had fun, and thanks for coming in. I mean, it was nice that we got to have a little quick lunch together and things like that. So
Yes.
Little powwow.
Great to see you all.
But let's get back on track and start to see each other a little bit more often. And,
Absolutely.
and we'll. So everybody, thanks. Thanks, Jill, coming out. Thanks, Jill Hunt, for joining me as well. And we'll see you guys again real soon. Take care.